Hi, it's Dr. Garza. Today I'm going to go over a common thing that we are doing in our office this summer, and that is the sports physical. So we have patients that are entering middle school and high school, and many of them need to have a pre-participation exam before they enter those activities in the fall. So in the summer, that's a big part of our practice. I've mentioned before that we do many well visits, and those well visits all include a pre-participation exam. We tend to default to do those for all patients, whether they need them or not. We fill out the form and then have that on hand for patients in case they need it for other activities or for different camps and other programs that might require that type of examination. So the goal of a sports physical is to keep children and adolescents safe. It's to identify conditions that they may have that could be life-threatening during participation. It's to identify conditions that may need to be treated before they may be allowed to participate. It's to see, what type of old injuries they may have and what symptoms they have related to prior sports injuries and musculoskeletal injuries. It's also to identify and treat conditions that could interfere with how well they perform or are able to exert themselves. And then we also want to remove unnecessary restrictions to their participation and really, letting them know that it's safe for them to participate. So ideally, we would like a sports physical done at least 6 weeks before the intended activity. And the reason is that if something is identified, we may need to refer them for further evaluation before we can clear them for sports or for participation, and so we want to have adequate time to allow for that. Part of the initial form, you might have seen it before, there's a standard UIL form from the state of Texas for public schools. Many private schools have their own similar versions of that form. The first page is about history, and so what we want to know is we want to know the patient's medical history, what surgeries they might have had, any type of congenital issues they've had related to their organs, or any surgeries related to organs. Of course, that's very important. History of heat-related illness, their current medications and supplements. We want to know their vaccine history and review that. We want to know about periods and menstrual history in girls. And we also want to know if there's a history of change in weight, either a rapid increase or decrease in weight. And so, when we review the injuries, we want more details. We want to know how much time were they out of their sport due to the injury, what limitations do they have on their sport after the injury, and how was the recovery, how is it impacting them now. We want to also identify if they've had any history of high blood pressure or a heart murmur, history of fainting or feeling dizzy, especially if that's related to exercise and exertion, history of chest pain, history of unexplained seizure. Any abnormal heart testing they've had in the past is very important for us to know. We want to know, do they get extra winded or short of breath more than expected for the level of exertion? And then, family history is important. Family history, we want to know, has there been any unexpected or sudden death at a young age, especially before age 50 in any family member? Is there history of congenital heart conditions or irregular heart rhythms? Is there history of patients' family needing a defibrillator or pacemaker, especially at a young age? And then any, family history of unexplained fainting or seizures is also something to note. And then we move on to the exam. So the exam, the first thing I always look at are the vital signs. We want to make sure that their blood pressure is normal, that their heart rate is normal, and then we look at their weight. And so we want to know about their BMI and their weight, and comparing that to prior exams that we've done where we can follow along a growth chart. We never want to see a patient fall into a lower curve on their growth chart, especially if that's a sudden drop, or even comparing over the course of a year, if there's been a big decrease in weight or BMI, that may be something that we need to note and evaluate further before clearing a patient for participation. We also do a vision test at every sports physical, and if patients have decreased vision, they may need to be referred for a formal eye exam before they can be cleared. We do an overall skin exam. Anyone with skin infections that could be contagious through direct contact, those issues need to be treated and cleared before they're cleared for participation. We do a heart exam, listening to their heart and listening for murmurs and the rate and rhythm of the heart, and we do that in different positions that the patient is in, standing and lying down. We listen to their breathing. We want to make sure that they don't have any enlarged organs in their belly. We do a testicular exam in males, and then we do an extensive musculoskeletal exam. So that is to look at the range of motion, flexibility, strength, and coordination, really from head to toe. So we're looking at how their neck, shoulders, arms, back, hips, and then balance. We're doing a full survey of how their joints and muscles work and making sure that they have good range of motion. And then we're screening all patients for scoliosis as well, which has to do with the curve in the back and the range of motion in the back. And so this is something that I can go through in a very standard way and quite quickly, but it's an important part of physical that we offer, especially during this time of year. So if your child or teen needs a sports physical, we're here to do that. That can be done on its own, or it can be done as part of a well visit, and we look forward to seeing you in the office soon.